Hi, I'm Sue Cressley, Medical Director at OP. To make sure all of you are informed and empowered with the 2021 code changes, let's take a look at problem status and see how OP can assist you. Per the AMA, they defined problems as a disease, condition, illness, injury, symptom, sign, finding, complaint, or something else that you address at the encounter, with or without a diagnosis being established at that time. And notice they emphasize addressed. Per the AMA, a problem is addressed or managed when it's evaluated or treated at the encounter by the provider reporting the service. So that notation in the patient's medical record that someone else is managing this problem doesn't make it count as addressing the problem. Referring the patient to a specialist for a problem without really a history exam or diagnostic study does not qualify as being addressed. Similarly, if your payers want you to report every diagnosis the patient has on their problem lists, if you do not address them and they are not pertinent to the reason for the visit, they cannot be counted when you are picking a E&M coding level for this visit. So here are all the valid problem statuses defined by the AMA, and you will notice that there is heavy weight on chronic illnesses. We have to remember that this system was designed with adult patients in mind, and many have hypertension, obesity, and hyperlipidemia without batting an eye. We in pediatrics live more in the acute world, and that gets a little more tricky. So let's take a closer look. When we're looking at straightforward complexity problems and those that would qualify for a 99202 or 12 based on new or established patient, we're talking about a simple, self-limited or minor problem. An insect bite, the sniffles, something that may actually have gone away whether or not the patient saw you. For a low complexity visit or a level 3 visit 99203 or 13, it is either 2 or more self-limited or minor problems. So you can take those sniffles and insect bite we talked about on a level 2 visit and you get to a level 3. This is the only time that adding these up matters. If you have 8 self-limited problems, it is still a low complexity visit. If you have a stable chronic illness, say the patient's asthma, but they're not really having a flare, but they have the sniffles and you talk to them about what might happen if their asthma flares, that's a chronic illness that you addressed. But you don't get to go up a level if you have 2 or more self-limited or minor problems and a stable chronic illness. It's one or the other. And then an acute uncomplicated illness or injury, a sprained ankle, a routine otitis without a patient looking sick, is an acute uncomplicated illness. So if you have a sprained ankle and stable asthma, you still are only at a low complexity visit. Getting into the moderate complexity problems, we're talking about 1 or more chronic illnesses with exacerbation, progression, or side effects. So an ADHD where the patient has anorexia or not acceptable weight gain based on their ADHD meds. That's a chronic illness with exacerbation. Obesity that's worsening. Asthma with a flare, that counts. Similarly, if you have 2 stable chronic illnesses, allergic rhinitis and eczema, but they're not flaring, that also gets you to a level 4 if you're addressing it. An undiagnosed new problem with some uncertain prognosis, abdominal pain, which you're not really sure what's happening, and you order some tests. Even if you're starting with constipation management, but you're not sure, that's uncertain. Systemic illness is tricky for pediatricians because it is supposed to be that the systemic symptoms sort of changes the management or complexity of your thought process. So having, for example, vomiting and nausea with strep throat, that vomiting and nausea would make your plan perhaps change, because if the patient can't tolerate their oral antibiotics, they can't be compliant with their therapy. And then there's the acute complicated injury, such as concussion with a brief loss of consciousness. High complexity problems are really, for those of us in pediatrics, probably those that we're thinking about hospitalizing. Either an injury poses a threat to life or bodily function, that could be severe depression, or a patient with asthma who you're sending to the emergency room because they're really having trouble despite treatments. Or it could be a patient who's having significant side effects from their treatment, and you need to do some higher level of care. So let's talk about how OP helps. Well, we allow at OP you to define a problem status at the level of the templates. So if you have a template for otitis media and a URI, you can actually add those problem statuses directly in the template. So every time you choose the template, or someone in your office does, it comes with the problem status and you don't have to think about it. However, when you apply the problem status, when the template is applied and used at a patient visit, they will come through, but the status should always be adjusted as appropriate for that particular patient. If this is recurrent otitis, you may change that problem status in the drop down to something that might be actually chronic or recurrent and now worsening. You can easily add an additional diagnosis and assign a problem status during the visit. That's great for those oh by the ways. And how many times has a parent said, wow, his eczema is flaring? And here's where documenting this matters, because eczema in most patients is a chronic problem. And if they're flaring and you're about to write a steroid, that's increased. So how does the math work? Well, it's complicated. We looked at all of those level visits, and how do we remember how many points or what level does a chronic unstable and acute minor get you? OP will do the math for you, and through the details tab, we'll actually show you where that math came from. So in this case, we have a chronic unstable, that was the eczema worsening, and an acute complicated and an acute minor, that's the otitis and the cold. Well, realistically, what's really driving this to a moderate or level 4 visit is that chronic unstable eczema. That the acute minor otitis and URI don't actually add it. You can't go up to a level 5 just because you're doing them together. And remember that in order to pick the level for the visit, it has to be 2 of the 3 sections that must meet this: problems, data reviewed or analyzed, and risk of complications. And if we look here, this patient we wrote some medications for, probably some mometasone and high-dose amoxicillin if I go back and look at my note. And that will drive the risk of complications to moderate. So we've met the 2 out of 3, moderate problems, moderate risk of complications. That's a 214. Thanks for listening and happy coding.